Good morning, everyone. Good morning, Queensland. So, $1,820 people get tested. So once again, this is great work. And can I just remind Queenslanders, if you have any symptoms, of course, please go and get tested. Now, in relation to the Grand Chancellor group, the 129 that were transferred, I have been advised that all have tested negative. So that's good news because that was our high-risk group that we were looking at. The 147 people who left since the 30th of December, the ones that were in Queensland have all been tested and have tested negative. So once again, good news. And of the 226 staff, all have been contacted and some of them have been tested. So we're still working through that. But out of the 502 in total, the Queenslanders have been contacted and the vast majority are negative. So we're very happy with that. So look, I hand over to Dr. Young. The only thing I wanted to say in relation to, we addressed looking at alternative forms of accommodation. I just want to update everyone that these investigations will continue about looking at different options. And as I said, that I will be discussing this at National Cabinet on Friday week. Please give me the opportunity to speak to my federal counterparts. And of course, this is a proposal that we are looking at. And of course, there needs to be a lot of work that's done there. But I think we need to have these options on the table because, as we know, there's a lot of this UK strain circulating at the moment in UK and parts of the Northern Hemisphere, and we do need to make sure that we have the best lines of defence here in Queensland to combat this virus. So with those few words, I'll hand over to Dr. Young.
Thank you, Premier. So 3 new cases overnight. The first case is a gentleman in his 60s who's in hotel quarantine in Brisbane, and he travelled here from the Philippines, so he's acquired it there. The second case is a gentleman in his 40s who travelled to us from the United States, and he's in hotel quarantine, tested positive. The third is a gentleman in his 40s who returned from the Congo in September, and he was in hotel quarantine then, tested negative, but he had to have a test done prior to returning to work, so an employment requirement, and he's tested positive. He's totally well, asymptomatic, so we think that is most likely a persistent shedding. We know you can shed for up to 9 months after you're positive, and it probably explains why we've continued to have all of those positive sewage results in North Cairns. If you remember, we've had quite a few of those and we've not been able to explain them. He lives in North Cairns. So that's the most likely explanation there. So now, of course, we're going to do some additional testing just to confirm all that, but I'm very confident that that will be a historical case and not infectious at the moment. So that's good. So we've then followed up the vast majority of all of the people related to the Grand Chancellor, all of those guests who were moved, all of the staff, all of the guests who've left before we found out about this issue. So I'm becoming more and more confident that there is no ongoing spread as related to that. So we're going to do some further work over the next 24 hours, and police will continue their investigation, of course, and we'll be able to work out what we need to do going forward related to that hotel. So that's all going very, very well. Plus, we've had a lot of support from the community coming forward to be tested from that area in South Brisbane, round that Logan area and so forth, due to those 2 cases having been in the community, and I'm getting increasingly comfortable, very comfortable, that we've not had community spread there. And I just commend everyone for what they've done. As soon as we knew we might have an issue in terms of that 3-day lockdown, it's so reassuring that we can use that if we ever need to again, because people were just brilliant at how they responded. And thank you to everyone for using the masks, because I think that really makes a big difference, and people have been fantastic doing that. So thank you very much.
Thank you, Minister.
Well, very good news overnight. Every day we are getting closer to that 1 a.m. Friday the 22nd of January lifting of restrictions. So we're really pleased that over the last 24 hours we continue to see negative test results for all these people who have been close contacts and contacts associated with the Grand Chancellor and the cleaner and her partner. So I want to thank Queenslanders, thank those people from Greater Brisbane, and simply ask Queenslanders and people visiting Queensland to continue to be tested. If you have any symptoms whatsoever, of course we want to make sure that we are keeping our testing rates high. So please, any symptoms whatsoever, come out, get tested and stay home until you get those test results. This is how we can make sure that our community stays safe, and we all look forward to the 22nd of January to be able to see those restrictions lift if the results continue to be as positive as we have seen up to date. Thank you.
Good morning, everyone. As you know, the Queensland Police Service have the lead in a joint investigation with Queensland Health to determine how the cluster occurred, obviously, in Hotel Grand Chancellor. We have well and truly started this investigation, and I ask you to be patient because there is a fair way to go still. It's a lengthy process, and we will make sure, obviously, that we interrogate every aspect of what has occurred in that hotel. Environmental swabbing of the hotel has been completed, and this is literally where swabs are taken off the service area where staff work, the walls, materials in the hotel, etc. And this will be subjected to extensive testing by Queensland Health. Interviews have taken place of 3 of the 6 infected people, and this isn't straightforward. As you can appreciate, some of these people are sick in hospitals, so their health and well-being must obviously be considered in context of the overall investigation. Ongoing inquiries will be conducted, obviously, with the Queensland Police and the ADF, and also investigation priorities will continue with the remaining infected people, other cleaners, hotel manager, occupants of other rooms, and also any other cleaning staff. Can I thank the staff at Hotel Chancellor? They've been absolutely brilliant in their cooperation in terms of this investigation. Other aspects of the investigation which we'll be looking at, incredibly important, policies, procedures, protocols and training in terms of what occurred in that hotel. This will be combined with infection analysis by Queensland Health to compile a list of joint recommendations, so not only finding out what occurred in this instance, but also joint recommendations relevant to the entire hotel quarantine program. The issue identified so far in terms of CCTV, that hotel did have CCTV in many aspects of the hotel, but not on that floor. And whilst I think we were quite satisfied when we have done many reviews of our quarantine procedures, so what we have is CCTV in many parts of the hotel, and police and other staff conduct very, very comprehensive patrols of all the floors. I've asked a full audit of all hotel quarantine hotels in terms of their CCTV footage. And what we will do is, if we find that there is any gap in that whole process, that we ourselves make sure that we put CCTV footage into those hotels. And that has already commenced in 2 of the hotels. So the other thing I wanted to touch on, yesterday there was an issue raised that a father and a daughter, there may have been a potential breach of quarantine on the 11th of January, and this was reported quite extensively yesterday. I can tell you from extensive independent inquiries that the daughter was wearing full PPE at all times. She was transported by QAS, not a taxi or Uber, from the hospital back to the hotel, and was then escorted by 2 police officers back to her room. So please, if you hear anything about that, just make sure that we do get the right story out there. I'll leave it at that, and I'll just obviously wait for more questions from the floor. Thank you, Premier.
Commissioner, on that, first before you leave, in regards to that potential breach, regardless of if anything wrong was done, as you say, nothing wrong was done, this is of public interest, I would argue, given that we are looking at how this spread within the hotel.
Yeah.
Any movement of anybody who has since tested positive, do you think the public should have been told that this person has left the hotel, or both people have left the hotel? I would have thought that we should have been told that, especially given the amount of press conferences we've had this week.
Okay, so I'll leave that to Jeanette. The only reason being is because I would think that there's transports often to hospitals, and QAS are always involved. So I'll leave that question specifically to health, but this is not a one-off. So, and it's always done within the proper protocols that occur within quarantine hotels.
So who made the call to let that daughter accompany the father? Whose call was that?
Jeanette will answer that because I've got the brief from her this morning, so I'll let her answer it. But definitely I understand, because the father, in terms of his English fluency, it was best to have the daughter travel with him. So that was determined, I'd say, by health. But I'd let Jeanette answer that, and I'll come back for more questions if you want.
We have over 3,000 people in hotel quarantine, and a number of them are frail and do have other health conditions. So it's not unexpected that people leave the hotels to access healthcare. That's been going on for a long time. Of course it has. And we have always required them to leave in an ambulance wearing PPE. So they are treated as if they're positive. So when they get to the hospital treats them as if they're positive, works through what's wrong, and then if they're well enough, they go back to the quarantine hotel. If they're not, they stay. So that happened with that gentleman. So he was taken there because he had some health issues, which were probably early symptoms of his COVID in retrospect. So we didn't get a positive result on him till the next day, but it doesn't matter because he went via ambulance to the hospital, was assessed there, was treated as if he was positive, was kept because he needed to for the symptoms that he had. Now, his English is not great, so the daughter went with him, but she was treated as if she was positive. So they were managed in negative pressure rooms, etc., etc. So there's no risk. And all of the transport was done via QAS. And that is QAS's job, and they do it very, very effectively. They move infectious people, not just COVID, but other infectious people. So there's no issue here at all. The hospital asked that the daughter go with the father because of his lack of English.
How common is it for people to accompany loved ones to hospital and leave hotel quarantine?
Well, it depends on the situation, but if it's a child, for instance, yes, a parent would go with them. If it's someone who English is not their first language and they have problems communicating. But the important thing to recognise is that whoever goes is treated as if they're positive. So it's not an issue from my point of view. We've been getting more and more positives in hotel quarantine. All of those get moved immediately to hospital, as has occurred with our 2 new cases in hotel quarantine today in Brisbane.
Regardless of if it's an issue though, as a member of the public, do you think the public should have been told that someone who's later tested positive with a strain that we're treating so seriously had left hotel quarantine, gone to hospital and gone back? Regardless of if it was an issue, do you think the public had a right to know?
No, I don't think so, because this is what we do every single day. We move people out of hotel quarantine to hospitals and have them assessed. And we've had other cases where people have then been found to be positive. That's what we do, and we always do the contact tracing as well as an additional precaution. So we immediately, when we knew that that lady was positive and infectious, when she went to the hospital, checked, and the hospital said, yes, we treated her as if she was positive. There's no concern. That's why we have a hotel quarantine program, and that's why I've always, as you all know, been very reluctant to let people leave that program. So we've, over the months that it's been going, we've gradually tightened it up more and more and more. You would have seen initially we allowed fresh air breaks. We don't allow them now. Initially we allowed people to go out and visit sick relatives. We don't now. There's all of those things that have happened over the last year.
Dr. Young, New South Wales Health Minister said putting quarantine facilities out into the region was against public health advice in New South Wales. What's your view on it?
New South Wales is a different state to Queensland. They'll have different issues. They'll have different abilities to respond. They need to make their decisions in the best interest of their people, depending how they can manage. And we will make decisions here that the Premier will take in the best interest of Queenslanders. But we've just got to remember, every state has different situations and they've got to deal with the situation in their state.
Dr. Young, can you just update us on, yesterday it was alluded to that there's some kind of engineering investigation element to all of this at the Hotel Grand Chancellor. There's been a letter circulating that's been signed by a number of doctors about, you know, the air conditioning potentially being the culprit here. Can you just update us on what you've been told about the air conditioning and the engineering investigation?
Yeah, so right from the start, I've suggested that perhaps maybe air conditioning might be an issue. I don't know that it is. I've got no advice that it is or it isn't, but it's something to look at, and police have included that in their process to look at.
In terms of the girl who went to hospital with her father, are the people who accompanied her in the ambulance and whatnot, are they in quarantine or is that not necessary?
No, because ambulance officers wear PPE every single day. They know how to wear it, they know how to use it, and they move people every single day who are infectious. So no, they're not in quarantine. There were no breaches. So that's what we always do. We just go back and check and say, are you confident that you've managed all this? And they've gone yes, because sometimes there are breaches. We saw that in New South Wales. If you can have young children, sometimes it can be hard to manage. So sometimes there might be a breach, and then of course we'll quarantine, and we've done that in the past. You would have heard that a couple of times we've had to go and quarantine health staff because of issues that have happened. So we do that contact tracing no matter what.
And the lockdown in Victoria that went on for months and months started from a breach in hotel quarantine. How come that hasn't happened in Queensland?
Because I think people have responded very quickly, and we found the first case. That's the most important thing. Every single time, if we can find the first case, we can get onto it really, really quickly and we can manage it. And all of the modelling shows that. If you wait till the 40th case, it is really hard to get on top of it.
So do you think if we didn't have that 3-day lockdown, it could have escalated?
I don't know. That's something that in retrospect I'll go back and look at, but it's been extremely reassuring because, for instance, we've had the second gentleman and he could have been, well, he was out in the community infectious, but then we had the lockdown period. So we've got to untangle all of those dates and times, but I'm very, very grateful to the Premier and to Queenslanders to doing that 3-day lockdown. I think that was absolutely critical. How critical, I don't know. We'll work that out, but a very, very good process.
Dr. Young, do you have a breakdown of the 147 guests in terms of, the Premier was saying that in Queensland, all of the Queenslanders have tested negative. Do you have a breakdown of how many were still waiting to get tested, or?
I do, but I don't have it with me.
I'm sorry, just to clarify on that, the 147, have they all been tracked down or you're still trying to?
No, some of them haven't been because they're maritime workers, so they're on vessels overseas. So we are trying to do that through the National Incident Room and through the maritime people. So yes, so there are potentially people, but just remember, while we get all these other results, that means their risk is actually getting less and less and less. So even if we can't track them down, their actual personal risk is less, and I just wanted to get as much information as I possibly could, and so every single person just gives you another bit of information.
And how many of the police who were forced to quarantine are still waiting to undergo testing?
Yep, so they're not yet at day 14, so that'll be sorted so they can leave quarantine day 14. So there was a big changeover of police, well, all of the police changeover on the 2nd. So 14, so those people who left work and went back to their homes on the 2nd will have 14 days, and that's about to come up, and they'll be tested before then and can leave quarantine.
If the hotel quarantine did move to mining towns, would there be an indication as to a timeline, like weeks or months?
As I said, just let us do that groundwork first, and then I want to consider it carefully and then put a submission to the federal government.
Just on that issue, is the government considering if it can't find an appropriate mining camp for workers' accommodation to build its own quarantine facilities?
No, no.
Premier, some of the Western long-term residents are upset that they weren't informed ahead of time that the Grand Chancellor people are going to be transported there. Do you think they have a right to be upset about that?
No, because they are being treated just as everyone else. And like we said, we took that precautionary step that Dr. Young recommended to move people from the Hotel Grand Chancellor to the Western. And yep.
Sorry,
yeah.
You mentioned a couple of days ago that the air conditioning was one element of the investigation. Can you just tell us who are the experts, engineering?
Well, I don't have who those experts are, but they'll be doing a lot of testing and they'll be putting their reports through as part of the police and health investigation.
Just a question for the Commissioner.
Oh, can I ask?
Yeah, sorry.
Yep.
So just on the mining camps, can Queensland go it alone? Is that something you would do after taking it to National Cabinet?
Well, in Northern Territory, they use Howard Springs, and that's used very effectively, and they haven't had any issues there, to my knowledge. So I do think there's an opportunity for us to explore this option and give it careful and detailed consideration.
What's the process for revising hotspots around the country, allowing people from other areas to come into Queensland and not quarantine areas that haven't had cases for a while, such as Wollongong, for example?
Well, that's a matter, we look at that, and we're actually going to be looking again at Greater Sydney. My understanding is in the 28th, at the end of the month, and we'll be able to update people there. But once again, we're looking for those 28 days of not having community transmission.
Just on that, with the 28 days, why is the health advice 28 days for revoking hotspots in other areas, but travel within Queensland was allowed before we'd even reached the end of one incubation period and Greater Brisbane was declared a hotspot?
Well, each state will also have their views, but the 28 days is the recommendation from Dr. Young.
But why was that recommendation applied for the Greater Brisbane hotspot to the rest of Queensland?
In terms of?
Well, if we revoke a hotspot in another state, they have to report 28 days of no community.
Yeah, because we know the first person, and we're doing everything we can to identify those contacts, make sure they are isolated and tested. And we're going to get to that end of that 14 days by, was it 1 a.m. 12:01 a.m. on Friday morning. Okay.
Premier, what do you think about Jackie Trade potentially making a move to federal politics?
I haven't heard that, but that's clearly a matter for her.
Do you think she'd be good in a federal role?
But she's very experienced. Yeah.
Have you been in contact with her since
No.
the election?
No.
Commissioner?
Yep.
Thank you.
Yes.
What did you think of the QPU's Vice President Shane Pryor's comments about Queensland Health yesterday?
I understand that the police were frustrated that they hadn't received any phone calls, but my police had been actually contacted by us a number of times. And in fairness to Queensland Health, they've had to make hundreds and hundreds and hundreds of telephone calls. So for them, and I won't speak on behalf of Jeanette, but I'm sure there must be a priority as to how they do this. My organisation, my officers are very, very well informed. So we made sure we did that, and when that was, I was approached by obviously my staff about that yesterday. I spoke to Jeanette, and we happened to be together, and we put a process in that we could actually inform our staff what had to be done. So it was addressed immediately. I can understand the frustration, but definitely I think we need to be patient in the most challenging times we've ever found ourselves in. And yes, we have now worked through those issues.
And in terms of the CCTV audit, is the goal to have CCTV on every level of the hotel? Can you just explain that a bit more?
Yeah, so what happened was, throughout this whole process, when we started doing this from the beginning of March, and the doctor touched on it, we've been doing internal reviews constantly to make sure that we, improve our processes. And there's been many aspects to that. And whilst we were completely satisfied with the CCTV in hotels, complemented with the amount of police and the patrols that we have, the last variant, I think, really has changed the game. So I've asked an audit of all the hotels to make sure that not only do we have patrols, but we have additional CCTV as well. Some of the hotels already have this, and they always have some form of CCTV. But I want to really up the ante here to make sure that we have every aspect of every floor covered into the future.
You say there's 2 hotels that's already happened at. Can you tell us which hotels they are?
So we've put it at the moment in the Western, I think it was 4 points. So this will be a rollout though, so that hasn't quite finished, so it's happening as we speak. But certainly this will roll out over the next couple of weeks.
Put CCTV on every floor of all the quarantine hotels?
Where we have people obviously returning from overseas. Interestingly, can I touch on some numbers, and I was going to because I think this is incredibly important, just to get a sense of the challenge in terms of numbers that we are still dealing with. So yesterday alone, 81 domestic flights came into Queensland. So 11 of these were from hotspots, 2,200 passengers just in the last 24 hours, and 7 were refused entry. On the roads, just in the last 24 hours, 5,220 vehicles intercepted, 12 vehicles turned around, and 20 persons refused entry. And yesterday, 187 people went into hotel quarantine, 142 from international travellers and 45 domestic. But I wanted to touch on, since we commenced this on the 27th of March last year, the total number of international travellers processed in Brisbane, 40,660, and 32,218 obviously went into hotel quarantine. So when you look at the sheer mass of numbers, it's been quite an extraordinary effort. And yes, and what the doctor has said, it has been an extraordinary learning process. But we are good at reviewing, and we are good at learning and implementing and being ahead of the game.
Commissioner, you said 3 of the 6 have been interviewed. 3 of the 6 international people have been interviewed.
Yep.
Why have the other 2 not been interviewed?
Oh, definitely. The reason why, bear with me, I'll take that off and that would be easier until I finish. Some of these are still sick. Some of these people are still sick, and we really have to work around their well-being, and they're still in hospital. So I don't want our staff rushing into hospital, into those areas to do the interviews if we can wait for a little while. So that's incredibly important for us.
Are you asking you, Dr. Young?
Commissioner, you would be aware of the finalisation of an internal review into Detective Senior Sergeant Chris Fenelon and
Yes.
rape investigation. Can you please tell us why the victim at the centre of that doesn't have a right to know what the result of that internal investigation was?
So she will definitely get that result. I think there was a bit of a miscommunication about some earlier information that wasn't released, but definitely she will get a very good outcome advice as to what has occurred. So something happened throughout the process where information wasn't released, but she definitely has the right to get that outcome of the investigation, and she will. And I understand if it hasn't already happened, it will happen maybe in the next day or so.
So she will be informed?
Yes,
of the...
yeah. And that really came down as about a miscommunication as to what occurred some weeks ago, I understand. So that was always the intention that that would happen, and it will happen. And as a victim, she definitely has the right to know that.
Okay, thanks everyone.
Thank you. Thank you.
Can I ask one more on the CCTV?
Yes.
Sorry. Just how many hotels are we talking about, and how long is this rollout going to be?
So at the moment, bear with me, I think we have 18 hotels that we are using But we're also going through the process of separating international and domestic passengers as well. So I don't know if it will be the whole 18. So we're going through an audit process of what hotels and who goes where. You know, international hotel passengers returning definitely, so just bear with us. I don't know if it'll be all of those hotels yet. Thank you. Thanks, guys. Did you like my new mask? I put this one on purpose. Thanks, guys. Take care.